Hi, I'm Dr. Stephen Heilman. I'm a chiropractor in the city of Escondido, California. Today we're going to be talking about carpal tunnel syndrome. First of all, carpal tunnel syndrome affects about 6 to 12% of people and more frequently affects women. And what the symptoms are is most people complain about pain or numbness in their thumb, forefinger down to the wrist. But a lot of people are also complaining about symptoms in the forearm. But for true carpal tunnel syndrome, it would start at the wrist and move towards the fingers, the thumb and forefinger. When we're looking at the hand, again, this is the area that would be affected with true carpal tunnel syndrome. If it is affecting this side of the hand, it is a different nerve affected, and that would be called the ulnar nerve. So we're looking at the carpal tunnel. You can see that this is the bones of the forearm, and this is the bones of the wrist, and then you have the bones of the hands. This cluster of bones will go through and form an arch that the median nerve passes through, and the median nerve is the nerve that would be affected in true carpal tunnel syndrome. The problem with this is there's a lot more structures involved of the wrist that may be causing these symptoms. It doesn't have to be specifically a narrowing of these bones. We could be looking at other tissues being involved. When we're looking at the hand and the forearm, you can see on this chart here that there is a lot of layers of muscles that are involved in that area. And if those muscles or tendons or ligaments are inflamed or aggravated, that can be causing the same kind of compression to the nerve. And our experience is that the muscles and soft tissue of that area more frequently cause the symptoms of that pain and numbness in the hands more than a narrowing of the carpal tunnel. So when we're looking at this, you can see that we have a lot of powerful muscles in the forearm that can be aggravated, and this would explain why a lot of people complaining about this are having almost more forearm pain than the numbness or tingling in the hands or pain in the hands. So when we also look at the pain that can be going farther up, is we could be having, there's three main nerve supplies going into the forearm, into the hand. We have the median nerve, which is most commonly affected in carpal tunnel syndrome. You also have the radial nerve, which gets more frequently blocked in the elbow on this side, that can create very similar symptoms, or you have your ulnar nerve, which is affected on the other side of the elbow. Each one of these nerves comes from the C5 through T1 nerve supply, which is, when we say C5 through T1, we're talking about the nerves coming out from the middle and lower half of the neck. So if this median nerve is being affected all the way up in here, if we're just focusing on the pathology down here that could be causing these symptoms, and the actual root cause is caused from either in the elbow, the shoulder, or the neck, just addressing this small area is not going to alleviate the problem. At Heilman Chiropractic, in my office, we have, the first thing we want to do is do a complete evaluation to see where the nerve is being damaged. And we want to determine if the pain is truly coming from the wrist or if it's coming from the forearm, the elbow, the shoulder, or the neck, so that we can go through and clear that blockage so that we can get normal function in there. We use several different types of modalities or treatments to deal with this problem. It could be from adjustments of the neck, it could be adjustments of the wrist, elbow, or shoulder. We could be using myofascial release, modalities such as electrical muscle stimulation, ultrasound, or what we use in our office most frequently, because we find it's the most powerful penetrating types of therapy in that tissue, more powerful and deeper penetrating than ultrasound or electrical muscle stim, is one of our class 4 lasers, whether it be our LightCure or our Nexus laser. That treatment can go in there and stimulate that nerve tissue, help relax the muscle tissue, and calm down the nerve inflammation. And we also use a very powerful massager called a Rapid Release. Now, a lot of times they'll do by hand a cross friction massage. which can affect the very superficial muscles, but the rapid release is a very deep penetrating muscle massager that is very comfortable. It doesn't have the bruising associated with the cross friction massage or Graston type therapies. It's a very quick therapy and it feels really good, and we get very fast results with it. So if you're dealing with pain or numbness in your hand, fingers, and you're suspecting it's carpal tunnel syndrome, or it might not be responding to the other treatments, the physical therapy or the acupuncture that you have been going through, and you're trying to avoid going through the surgery because you know that the surgery is going to have a lot of downtime afterwards. It's a very tough recovery and it results in a lot of scar tissue. Contact our office at 760-480-4480 and we can go through and do the full evaluation and see if one of our treatments may give you better results than what you're going through already. Thanks for your attention. I hope this was informative for you.